Live from the Scripps Studios, this is 10 News.
The highest levels of county government imploring San Diegans to stay at home. Today, the county's top emergency response team doctor revealing the real number of cases is vastly different than the official number. Good evening, I'm Kimberly Hunt. And there are now 131 confirmed local cases. County Epidemiology Director Dr. Eric McDonald estimated the real number of cases is likely 10 times that. And there's also been a big jump in the number of people hospitalized. Yesterday, it was 13. Today, there are 27 people in the hospital. The county also posted the cases city by city. More than half of the region's reported cases are in the city of San Diego. We have put together an interactive map with that information on 10news.com. As city officials echoed the warnings of the governor to stay home, one city councilman shared his own story of loss from the H1N1 virus. 10 News reporter Laura Acevedo caught up with the city councilman after the press conference about why he decided to share his story.
Kersey tells me he shared his family's story today, hoping that people will take this virus and the warnings from officials seriously.
A great family guy. He was a real hands-on kind of guy. He loved working with his hands and tearing stuff apart and putting it back together.
Mark Kersey's brother Brad would have been 44 years old today.
It's tempting again to look at this and say, well, we survived SARS and H1N1 and we'll survive this too, and we will get through this. But you don't want to be a statistic, and you don't want a family member to be a statistic.
Friday, Kersey shared his brother's story as a warning to take COVID-19 seriously. Kersey's brother died of the H1N1 flu strain 6 years ago at the age of 37. He had no underlying conditions.
A little concerned as you are when a family member gets sick, but we weren't overly concerned.
But then Kersey says his brother's condition got worse and he had to be hospitalized. Kersey rushed to Pittsburgh to be by his side.
By the time I got there, he was already in the ICU, and he was on a respirator and everything. But I never got to say goodbye to him. He wasn't even conscious at that point.
Brad Kersey left behind a wife and 4 children, 2 elementary school boys and 2 high school age girls.
Not having their dad around it's been really hard for all 4 of them.
Kersey wants those that are younger to stop thinking the virus only affects the elderly and those with underlying conditions, because in his brother's case with H1N1, Brad Kersey was neither.
There's no real justice when it comes to these kind of things. The virus doesn't care. It doesn't care if you're a good family man or if you're, a mass murderer. I mean, the virus is going to get who it gets.
In downtown, Laura Acevedo, 10 News.
San Diego County's chief medical officer explained the reality that testing doesn't reflect the totality of the pandemic locally. It starts with testing. There simply isn't enough for everyone who's suffering mild or moderate symptoms. And Dr. Nick Ifantides urged everyone to stay home so that our healthcare system doesn't get overwhelmed.
We need to prevent the preventable so that we can be prepared to deal with the inevitable. We are still very concerned about the capacity of our healthcare delivery system.
Doctors stress that if you have mild symptoms or you were exposed to someone who has the virus but you're showing no symptoms, you will likely not get a test. In less than an hour, the southern border will be closed to all non-essential travel. Earlier today, Secretary of State Mike Pompeo announced the U.S. and Mexico have reached an agreement for a partial closure to slow the spread of COVID-19. 10 News anchor Lindsay Pena shows us how these changes will impact all of us.
Just hours away from a partial border closure, the San Ysidro port of entry was relatively quiet for a Friday night. Pedestrian and vehicle traffic noticeably less than usual. Starting Saturday, this area will be closed to all non-essential travel to slow the spread of COVID-19.
For cargo, business continues as usual. For pedestrians and for vehicles, there are going to be some restrictions, basically prioritizing essential travel.
Gustavo de la Fuente, director of the San Diego-Tijuana Smart Border Coalition, says while trade won't be restricted, there are still a lot of questions as to how the rules will be enforced.
There's going to be a variety of cases, right, and situations that people are going to have. And of course, any list cannot answer every single question that people are going to have.
According to officials, people who cross for work, medical appointments, or for education will be able to, as long as they have proper documentation. But those who make a living from tourism are definitely worried.
Everybody's canceling.
West Barba runs Baja Border Tours, where he takes visitors to places like the wine country in Ensenada, Mexico. He's had to cease operations and worries the small businesses in Mexico that his customers support will take a hit.
All those guys selling churros, selling blankets, selling souvenirs. I'm worried for that poor people because they survive on $30 a day.
At the U.S.-Mexico border, Lindsay Pena, 10 News.
San Diego State is postponing all in-person graduation ceremonies from May to December. And despite that, there will be a virtual commencement ceremony for everyone on May 16th. And even though commencement is postponed, students who are on track to graduate with degrees will still do so. Covered California is launching a second open enrollment period as the state faces a surge in coronavirus cases. Californians can get health care coverage through June 30th. No special circumstances are required to enroll. The state says it will expedite applications for senior citizens and others considered more vulnerable. And those who sign up will still be eligible for new subsidies announced last year. Covered California is hosting webinars in each region to help answer questions, and you can find that information at coveredca.com. Arizona just recorded its first death from the coronavirus. Health officials there say it was a man in his 50s. And tonight, the number of infected passed 19,000 locally. ABC's Mark Stewart has the latest from New York as many Americans wonder what's next.
Life in the U.S. is quickly changing as 1 in 5 residents in several states are ordered to stay inside as the coronavirus pandemic intensifies, including in America's biggest city, New York City.
We are now the epicenter of this crisis.
The governor of New York joining California and other states in issuing new mandates, beginning Sunday, ordering all non-essential workers to stay home, telling residents to stay indoors as much as possible and only leave to get food, medicine, or solitary exercise.
Essential services have to continue to function. Grocery stores need food. Pharmacies need drugs.
From first responders to families, no one is immune from the impact.
I'm very nervous, just feeling like, when is this all going to end?
Even with precautions, this New York City doctor tested positive.
I was using all the protection I was supposed to. I probably just wiped the surface with my hands and then wiped my face between mask usage.
Friday, President Trump announcing he's invoked the Korean War-era Defense Production Act, directing American companies that can, including automakers, to now manufacture masks, gowns, gloves, and ventilators. And in New Orleans, we get a look inside Ochsner Medical Center, where teams are using special respirator masks for protection, as World Health doctors urge young people to take the threat seriously. The Centers for Disease Control says nearly 40% of the people hospitalized in the U.S. are between the ages of 20 and 54.
I just want to let everyone know that, it's very important to stay inside and follow the CDC guidelines.
Also, a malaria drug being tested as a possible treatment for COVID-19, drawing a sharp rebuke from one of the president's top health advisors.
I agree with the doctor, what he said. May work, may not work. I feel good about it. That's all it is, just a feeling.
It might be effective. You're also collecting data that will ultimately show that it is truly effective and safe under the conditions of COVID-19.
Even though people living in several states are being told to stay at home, President Trump is still insisting he is not considering such measures nationwide. Mark Stewart, ABC News, New York.
The coronavirus has officially hit Bachelor Nation. Today, Colton Underwood announced on social media he tested positive for the virus. The 28-year-old Bachelor and former NFL player says he started showing symptoms a few days ago. He added he has been following social distancing guidelines since last week. Underwood is now encouraging others to stay home and protect their loved ones. The Salvation Army is offering child care to support healthcare workers and first responders. Starting Monday, the Kroc facility in Rolando will offer care camp for those who can't stay home. It will be limited to 24 children. Spots will be given on a first-come, first-served basis, and parents must provide proof of employment. You can register online at crocsales.org. The care camp is scheduled through April 10th. The center will also distribute food for students and baby supplies in the coming weeks. United Way of San Diego is helping laid-off workers pay their utility and housing bills. Anyone who is suddenly unemployed or working less than 10 hours a week can apply. United Way will send checks to landlords, mortgage, and utility companies. Financial assistance will be based on financial need and family size, and you can find the application on their website, uwsd.org.